My name's Professor Shilpanjali Jesudason. I'm a kidney specialist. I'm the Director of Dialysis at the Royal Adelaide Hospital in South Australia. I've had a very interesting pathway in my career. I did my undergraduate training at the University of Adelaide Medical School and then did a research and clinical fellowship in London, experiencing new transplant technologies in kidney, pancreas and islet transplantation. I then came back to South Australia and did my PhD in transplantation immunology through the University of Adelaide at the Queen Elizabeth Hospital, and that was a fantastic journey of basic science, bench work and using new models to try and understand why transplants reject and what can stop them from rejecting. Following that, I undertook a change in my research pathway to focus more on clinical research. And over the last 12 to 14 years, I've developed a range of research programs from pretty much the ground up. I have an interest in dialysis care and research around how patients cope with the transition from advanced chronic kidney disease to dialysis. This is a very vulnerable time, and I'm interested in research around exploring their symptom burden and how they make that transition. I've got a research program looking at pathways for preparing for dialysis and how this integrates primary and tertiary care. But my main area of research these days is around pregnancy and parenthood in people living with kidney disease, and I lead a program called Pregnancy and Kidney Research Australia, and we are doing a range of studies exploring the evidence base around pregnancy in women with chronic kidney disease of all stages, including women on dialysis and with kidney transplants. This is underpinned by a very robust consumer group who help drive our research priorities and research directions. We do a lot of studies synthesising the patient voice and patient experience. We work with large population data sets and registry data to define pregnancy outcomes, and we're starting a whole platform of work to translate the evidence base that we've been generating into toolkits to help women navigate complex decisions about parenthood and pregnancy, and to help the clinicians who are looking after them best support those women with robust evidence and good knowledge. So there's a range of research activities that I'm involved in at the moment. The passion for my research is driven really by the patients that I see in clinic. I have the privilege of working with these patients and often their partners, their children, their extended families, to navigate them through some really challenging times with their health and often some very challenging decisions. And I know that we need good research, we need a good evidence base to help them make those decisions and to deliver the best care for them. For me, the most fulfilling part of my work is when I can take the evidence that I've generated in my research and apply it back into directly my clinics or into the renal services that I'm involved in to try and improve the care for patients. I think in my pregnancy work, having worked with women sometimes for several years to get them to a good place to have a pregnancy, then seeing them through that pregnancy and having them come back to clinic with this baby that in many other settings would not have been able to be born, and seeing the joy that that brings to those women and their family, that's what really motivates me in my research every day. Work keeps me very busy, but it's really important to have a balance. I have my kids and my family that I focus on. I'm a very keen gardener. I have a Facebook page called Roses of Adelaide that really is a source of joy for me. And I'm a very keen traveller and enjoy travelling at every opportunity, slowed down by the pandemic a little bit, but really enjoying the chance to get out and about and visit new places and new countries.